Good day. I'm greeting everyone who joined us. My name is Olga Tamanova. I'm greeting you at the Media Center of Ukraine today. Today we invited you in order before the world's day of countering day, World AIDS Day, to talk about the pandemic situation in Ukraine, challenges and priorities. And today we will also present a redemption of the stamp, of the postal stamp, which was created by the foundation, by the Anti-AIDS Foundation, together with Ukrposhta. This stamp will be a reminder that despite the war, the pandemic, the AIDS pandemic continues. Now a bit more background. We know that HIV, AIDS continues to be a considerable threat for thousands of people, a full-scale invasion, complicated things when it comes to countering AIDS. And according to the healthcare center, over 133,000 people are living with HIV, and unfortunately over 90,000 people remain unaware of their status. And we will talk today about this. And I want to represent our speakers. Today with us we have Yaroslava Lopatina, Country Program Director, AIDS Healthcare Foundation in Ukraine. We also have today Larysa Hetman, Head of the HIV Infection Management and Control Department, and we also have today Ms. Gabriela Ionascu, UNAIDS Country Director, and we also have Nataliia, Mukhina, Head of the Stamped and Philatelic Products Department of Ukrposhta, and Olena, Pavlyshyn, Deputy Medical Director for Outpatient and Polyclinic Work, Second Medical Association of Lviv. I am very grateful that you joined today us for this discussion, that we joined our efforts. Okay, so Ms. Yaroslava, the floor is yours. I just want to ask you why today, now, during the war, it's important, especially important to keep problem of AIDS in focus. Yes, thank you. And the first cases of HIV infection have been recorded at the end of 70 years, in the late 70s of previous century. And so we have about 40 years of history of HIV infection, and it still has not been overcome. And now the world is faced with the new challenges, many conflicts, many armed conflicts in the entire world. In Ukraine, the full-scale invasion continues for 4 years for now. And we're also facing now another challenge, a reduction in financing dedicated to counter AIDS from the United States of America, reduction of financing from the United States of America. And unless something changes, we estimate that over the next 5 years, we'll see growth of over up to 5 million, 6 million, and almost 4 million of new cases of death from AIDS. And many of those cases will fall in Ukraine, for Ukraine, because Ukraine still ranks the second place in Eastern Europe by the number of people who live with HIV. And so we're bracing up for new challenges, and we need to join efforts of all stakeholders of our society in order to overcome HIV, because we need to remember the right for health is one of the fundamental rights of a human. And I also want to say, if we look at a history of the fight against HIV, even to compare like 20 years ago experience, we have gained so much, we have made so much progress in science. We have now antivirus therapy, and it's very safe, affordable. a person does not need to apply some considerable efforts. Does not need a lot of efforts in order to go through antiviral therapy. We have pre-contact prophylactics. We have post-contact prophylactics, injection, tablet. A human person does not need to take some medicine every day. So if we compare 20 years experience and nowadays the scientific progress has been significant, but what remains at the same level is stigma. And in my view, stigma almost has not changed. We still have such approach to HIV infection. Only specialists who work with HIV and AIDS, they perceive it as a threat, and this is a threat to public health. But other part of society which is not involved in HIV treatment, etc., the broader society perceives it as shame, and it's better to avoid this topic. This is the perception in the society in order to hide it somewhere, but still to cover it up. But this problem still remains one of the most serious challenges for public health in the entire world and in Ukraine in particular. Also, given the circumstances of the full-scale war, we know that all wars, they lead to exacerbation, to rampant infection diseases, and HIV is not exception in this case. And so, what AHF is doing, we're doing actually aimed at reduction of stigma. We create in cabinets, offices, we call them wellness centers, in order to avoid stigmatization. That's why we call them these medical offices, medical clinics, where people can, free of charge, get tested without being shamed. People can get tested for HIV, for sexually transmitted diseases. And this year, in order to remind all the people in Ukraine, because in Ukraine, their most popular transmission way is by sex, through the sexual relations, and so it's relevant to every person in Ukraine. And in order to remind about it to society, we jointly with joint stock company Ukrposhta, we created a stamp, a postal stamp, in which depicts almost all stages of fight against HIV. It depicts a reminder about the need to get tested, reminds about the need to reduce stigma, etc. So, in order to overcome HIV challenge, we need to join our forces. Only together we can reduce this problem. Thank you, Ms. Yaroslava. So, Ms. Larysa, now my next question is to you. I would like to talk about how the situation with HIV/AIDS in Ukraine. Good day, dear friends, dear colleagues, dear partners, journalists. Thank you for having me here, and for this opportunity to raise this topic, to bring up this topic on behalf of the Center of Public Health. Center of Public Health is a state agency which at the national level coordinates questions concerning prophylactics, diagnostics, and treatment of the infection. Of course, this is not solely, HIV is not solely our responsibility, but this is one of our responsibilities. And so here I support the previous speaker. Today we have a very powerful weapon, antivirus medicines. And thanks to them, we can effectively prevent and treat HIV infection and to keep this infection under control. And in order to, if if looking back into the history of fighting this infection in Ukraine, and if we look into the worldwide experience, and also at the level of Ukraine, for 20 years we have this experience when Ukraine, jointly with international partners, donors, medical personnel, nurses, doctors, public society, people who live with HIV, started this fight. And this is actually the story of success, professionalism, and humanity, because we have managed to cover a lot of ground over this time. We can even say that we have a separate law on countering HIV/AIDS, which clearly identifies a state policy and state guarantees. We have regulatory acts and the national strategy countering HIV/AIDS infection up to 2030. We regularly update medical standards of medical help. We have prepared medical personnel. We have very strong civil society. I can count many other components what we managed to achieve over these 20 years, and thanks to these achievements, we are at the level where we are now. And this is the story of success to which we all contributed. And this is the result of daily work of all of us. And I should also remind us about our circumstances in which we exist today. This full-scale invasion, full-scale war of Russia against Ukraine. And of course, in some steps, we needed to stop, to reflect on some moments. And the 2025 is not an exception to compare with the previous year. That this year posed certain challenges, but at the same time reminded us about resilience of our healthcare system, because we managed, despite absolutely all challenges which stood in front of us, we managed to establish sustainability and continuancy of treatment of HIV infection. And that happened thanks to our international partners, thanks to our government. First of all, that included diagnostic tests, antiviral medicine in order to prevent infection. Thanks to the Global Fund, thanks to FAR, we managed to ensure this continuity of treatment and prevention. In Ukraine, under medical supervision, there is slightly over 133,000 people who live with HIV. 70% of them receive treatment. That's slightly over 115,000 people who receive treatment. 96 people have good results, effective results from the treatment. And one of the important steps in public health was that a person who lives with HIV, who lives with treatment, has minimum risks of transmitting HIV through sexual means. Over this year, almost 2 million of people have been tested for HIV, and this is a good step for prevention. And in all public healthcare facilities, there are tests available. Over 10,000 persons received pre-contact prophylactics. And one of the very effective methods of preventive methods, medical preventive prophylactics. And I also need to state that we not only managed to provide tablet medical preventive form, but we also managed to expand injection preventive form, cabotegravir, at all regions of Ukraine. At the same time, even today and in the future, we understand that we now face challenges and we will face challenges that include access to key groups in the risk. This also includes the question of early diagnostics and the question of further ensuring continuity of treatment. So we need to hold together. And our main aim, main target, actually, to reduce to reduce new cases, appearance of new cases of HIV and AIDS, and to reduce stigma. We continue working. We are always ready to help, and I'm really grateful for inviting and the opportunity to be present at this event. Ms. Larysa, there's another question. You said that you managed to retain the level of testing at the same level as before war. So if we look region by region, what is the situation in the different regions? Do you manage to maintain the level of testing in all regions, or there are some regions that are lagging behind? Speaking about Ukraine, overall Ukraine, the testing levels remain at the levels of the previous year. This calendar year has not ended yet. We will be managed to analyze the full statistics in the beginning of 2026, but by the results of 6-9 month statistics, we see that the level is the same as year before. Speaking about efficiency, about revealing new cases, efficiency of revealing new cases. We have some reduction to compare with the previous year, and this is also one of the challenges which we also see before ourselves, and we develop plans for more targeting testing. And speaking about all regions of Ukraine, access to testing, thanks to medical guarantees program and thanks to donor support, in particular quick tests, is available absolutely at all regions. Of course, there are questions about territories which are close to combat activities, territories with temporary occupations area, with combat areas, considering safety situations and other questions. It's more difficult to carry out tests and to measure actually the statistics of testing. So it's quite difficult to measure. At the same time, people relocated from one region to another region. And for internally displaced persons, there are absolutely no limitations, regardless of their place of living, registration, or whatever. The free of charge test, confidential, is available to everyone. And speaking about treatment and preventive therapy, it's available at the level of all regions, free of charge. How many new cases how many new cases you recorded this year? 6,100 new cases. Thank you. And now I would like to ask you how globally UNAIDS adapted to new challenges which we face in Ukraine, connected, of course, with the war, with full-scale war, and what are the decisions which should be made because they should be different than comparing to other countries. So how the organization was ready for such challenges and what adaptive measures you took in place?
Being able to talk to you about the global AIDS strategies and everything that happens at the global world. I'm very happy that we have the honor to speak before the World AIDS Day, that is December the 1st. For December the 1st, UNAIDS this year has chosen a specific a theme, and it is about overcoming disruption, and it is about transforming the AIDS response. And one of the challenges that UNAIDS is overcoming now is trying to transform the AIDS response and adjust the global AIDS strategies based on the global financial crisis and also based on the crisis connected to the health systems strengthening around the world. For Ukraine, overcoming disruption and transforming AIDS is something very, very real because it is connected with war. You're asking how we are trying to adjust to the overcoming the crisis. But I need to say at the same time that for UNAIDS to do anything, we need to learn from the country experience. And currently, I need to say that Ukraine is one of the single country experience in the world that is overcoming AIDS in the condition of war. So we're actively learning now how exactly Ukraine is dealing with HIV and how they managed within the war conditions still to keep a very high level of treatment and testing. So I need to say that what your country gives now to the world is even more than the world can give it to you, including UNAIDS. I need to say that disruption for Ukraine is very, very real because disruption is about a mother giving treatment to a child while there is a blackout in the city. It's about the healthcare workers in Ukraine giving away medicines and taking care of patients while there is a bombing or insecurity risks outside. Disruption is also about NGOs working in Ukraine and keeping their doors opened to all people in need and those that need services for HIV, and it's very commendable. At the same time, I need to say that transformation and transforming the AIDS response, as UNAIDS sees now, is not exactly about doing something new. What Ukraine is doing is more than transforming the AIDS response. It's keeping the AIDS response standing out and keeping the activities going on, just giving it a little bit of different nature. It's about mobile clinics going to front zones to provide services. It's about people being so resilient and providing services even they are in a very dire mental state. So that is about Ukraine and that is about the global AIDS response. It's about continuous learning and taking the experience and the best practices that work at country level and feeding it into the global strategies. So thank you, Ukraine, for being a pioneer in terms of providing such a strong AIDS response and keeping it so strong so that other countries can learn from you.
Дякую, Gabriela. Ще
Thank you, Gabriela. I have another question to you. It's very interesting for us to understand the international experience. Both our previous speakers spoke about stigma. And according to Yaroslava, we have not managed to overcome stigma yet. Maybe you can share international experience. What are approaches, successful approaches to overcoming stigma?
I fully agree that stigma is a very, very serious factor in terms of fighting HIV/AIDS. But at the same time, you should keep in mind that, and I'm always saying it to my staff in the office, and I'm always saying to the government officials in Ukraine, you always need to compare yourselves to other countries. Stigma is an issue, but at the same time, we need to recognize that compared to other countries, Ukraine managed to fight stigma pretty much better than any other country. Because yesterday we attended the LGBTQI conference in Ukraine, and I need to say that Ukraine is not my first country, and I worked in other countries, and I would tell you that in the countries where I worked, even the fact of thinking that an LGBTQI conference is possible was impossible. You cannot have it in other countries. People will get killed. So you need to think that, yes, we need to overcome stigma. And by the way, media is one of the strongest allies in fighting stigma. And it should be used as an instrument to fight this stigma. And this is best practice worldwide. But please keep in mind that Ukraine is progressing not only in treatment and care, it's also progressing in terms of reducing stigma and discrimination. And somehow I think that this unfortunate war that started in Ukraine made people of Ukraine more tolerant to other people and to other people's problems. And I hope that in a couple of years, taking into consideration that we're having the long-term injecting antiretroviral treatment and prevention, will help Ukrainians to overcome the stigma and be more tolerant to each other.
Дякую вам, дякую за ваш погляд. Пані Олено, хочу долучити вас до нашої розмови і зайти в таку більш практичну частину.
Miss Olena, I would like to talk with you how available HIV testing is and some advice from you, whom you would recommend taking test for HIV and when this could be necessary. Dear friends, I'm very glad to be with you and to receive this invitation. Now, about testing, who should take this test? Everyone, despite national protocols are written in terms of some key groups. I recommend to take testing to everyone and to do this regularly, because one of the points of the national standard says if you have unprotected sexual life, then you should take this test. There are many cases when patients say, I have the only one partner, to which I always reply, do you have a single sexual partner, but you don't know whether you are the only sexual partner, whether maybe you don't know whether your partner has other sexual partners. And so whom I would recommend whom I would recommend to take test. Usually people are not willing to take this test consciously. So I would recommend medical personnel to recommend their patients to undertake this test. Because ideally, in ideal world, like everyone, once in a year, once in a half a year, would take this test. But this unfortunately doesn't work this way. And so in Lviv, coming from our experience, the initiative came from the medical personnel. And even if medical personnel will propose to their patients within the standards of their outpatient work, that would be enough, because currently we have the most challenge is that we have a revelation of infection at the late stage. And speaking about statistics in Lviv, over the last month, we revealed 3 people out of 5 who have two cells. Those 410 cells is the lowest level, and one of these men, 36 years old, he's in a very difficult condition, and despite our all efforts, we are far from timely testing. Yes, we are an example. Lviv is an example that multitest is much better, saves time rather than later, saves money and time, because it allows to timely respond to the condition. Also in Ukraine, the the detection level keeps between 0.7%, between 0.4 to 0.7%. But increasing of testing increases the detection level. And when the percent, there is just of course, if we look at the figures, it's depersonalized. But behind each figure, behind each percent, there are people, families with children, etc. And so, some statistics in Lviv, they have been tested 10,000, almost 13,000 people over. We understand that this is not a general population. Of this, it's just donors and pregnant. Of these percent, only 3 people have been detected with quick tests. In 2023, we had more cases detected. I'm not going to throw more statistics here, but over the last year, 2025, we carried out almost 35,000 testing and 22,540 with quick tests, and we detected 138 people. And 8 with quick tests. And those 8 were pregnant, and all the rest were discoveries made, detection made by medical personnel. I think that's a great success, and I'm very grateful to Anti-SNIDE of Ukraine, because 1/3 of quick tests, these are their tests provided to our city. And in the next year, I hope we will improve detection among Lviv Hromada, thanks to the supplies from the Public Health Center, and I will gladly share with you next year our success. And when now about stigma, we the agency, we were based in a common hospital, and with my 3 years observation, I can tell you that stigma is ruined where people understand, where people have knowledge, and then they're capable to accept. We don't have complaints to doctors. So doctors do not discriminate absolutely between patients. So if you don't believe, please come to us and you can check, you can see with your own eyes. I have another question, Ms. Olega, just to understand the algorithm of action for ones who received a positive result in this testing. Sometimes for people, this sounds like a sentence. Why this should be perceived not like a sentence, and what are the next steps? I will start from the end of your question, why it should not be perceived as a statement, because HIV already for a long time, it's not a statement. It's not in no way different from hepatitis B, which is treatable. Everyone lives with herpes, which also is treatable infection. People just need to understand a roadmap. Usually, patients are detected by family doctors or neuro specialists, and next year they direct these patients to infectionist specialists, retest this person. First of all, we repeatedly check these tests. Sometimes there are false positive results. If the results are confirmed, then we prescribe the treatment to patients and follow up and medical support. Thank you very much. Before we go to the next step of our next section of our presentation, there is opportunity for questions. If you have any questions, please. Now the mic will bring. I'm very grateful to the foundation for this organizing of this event. I have a question to Gabriela and Ms. Yaroslava. So you were talking about considerable role of healthcare institutions about detection of cases. Foundation Anti-SNIDE Foundation is one of the largest non-government organizations. Please tell me what role should be non-government NGOs, civil society should play at the level of communities, at the level of Hromada, and how to organize better and more correct services. Ms. Yaroslava. This question is quite a broad question. It's very difficult to answer to it briefly. I will try to be as concise as I can. So what we see that there are public organizations which are engaged work with target groups. And for the first time, I heard this at the European conference, which took place in Paris AIDS conference. This conference took place in October. So what I heard, they said, so when we see risky groups, key groups, we are blurring the problem because we need to call things as they are. If we say that where the HIV infection is concentrated, where the major risks, that's among men who have sexual relations with other men, drug abusers, drug users, sex workers. And so we need to train ourselves to learn how to say these words openly and not to hide behind such correct but blurred words as key groups. So when we speak key group, first of all, and we say that key groups members should run a test for HIV. You understand what it is. I understand what it is. But if we go to the street and ask a group of what a key group is, nobody will tell you what a key group is. Even people who are actually who belong to this key group, they don't know that they belong to the key group in terms of AIDS, HIV. So we can, some services, but not all services, delegate to, for example, initial testing. We can delegate some services to communities actually aimed at these key groups. And so new outreach, new approaches, as Gabriela rightly said, new approaches are not always new approaches. They're just adjusted approaches. And when we started with outreach, we also here need to explain to broader audience what is outreach. But again, I see from my angle, we have implemented many programs, and now we need to get back to the outreach work. We need to foster these workers, the outreach. So that's the worker who is representative of the key group, who could test his members of his key group, his friends, his acquaintances, because mobile laboratories could be more effective and better maybe, but it's very, very expensive. Now speaking about other approaches, it's a different level. For example, creation of clinics on the basis of society. This is what I saw in Europe. This is a very progressive approach. That's when a community itself creates a clinic. It shouldn't be like large-scale clinic, high profile. No, it could be a small clinic, licensed clinic, where representatives of key groups provide services to other representatives of key groups. And there will be the less level of barrier and stigma. Maybe, Gabriela, you would like to expand on that.
Whatever was said by Yaroslava, because these are common knowledge and international practice in providing services. Services should be provided by peers, and it works best when peers are providing the services. So this is what UNAIDS and UN generally recommends in terms of developing systems for service provision at the country level.
Прошу.
Дозвольте, я також не
I cannot go past this issue. So whether this service should be provided at the level of government organization or civil society, yes, it should be provided, this service. And it is being provided. Speaking about algorithm of testing and the national and recommended by the World Health Organization, test A0 is being carried out at the level of these organizations. Then next, after the testing, if cases are detected, then such patients should be redirected to healthcare facilities, specialized healthcare facilities. But if speaking about input of these organizations, this input is quite high in the overall pool among the overall cases which exist at the level overall in the country. That's at the level of 60-70%, which first time were revealed, detected at the level of NGOs. Then they were referenced to the healthcare facilities and now become part of the general statistics. And there is a quite broad network at the level of each region where NGOs are present, and according to the agreements with public health centers, in accordance with agreement through public financing, this level, at the level of the country, broadly, at the level of the country, it's quite broadly represented across the country. It's being developed, and I think this discussion could be continued. Thank you, Yulia, for your question. Thank you, Ms. Larysa. And now I want to give the floor to Ms. Nataliia. So now we will go to our presentation of our stamp and what I call the cancellation, the special cancellation procedure. First of all, tell us why is it important, cancellation now about the stamp itself. Good day, dear friends. And so Ukrposhta, just before the World AIDS Day, presents a new edition of stamp. But I should say that this is not the first time the Ukrposhta turns to this topic. 14 years ago, in 2011, Ukrposhta introduced a stamp AIDS 30 years in order to attract the attention of people that applies to millions of people. The theme of fighting against AIDS. And usually Ukrposhta does not repeat its topics of its stamps, but currently in the midst of the full-scale war, this topic is especially relevant because the war exacerbates risks, makes it difficult to treat, makes hurdles for treatment, and that's why the new edition of 2025, which is called the 1st December World AIDS Day, which is implemented by Ukrposhta, is so much important. It's known that in the world, worldwide, stamps of Ukrposhta are known for their symbolic meaning. And today's stamp that we issue is about prevention and support, and which makes us unconquerable. And we presented, so our stamp consists of 9 smaller stamps, and these stamps are available in online store of Ukrposhta. I would like to thanks to our partners for such a great initiative, and I would like to say that the design of the stamp belongs to Anti-SNID Foundation of the United States in Ukraine, and I would like to thank to all the speakers that you take care every day about health of Ukrainians, and we now are approaching to the ceremony of cancellation of our special stamp, to which I would like to invite all our panelists. You all see how the stamp looks. So now let's start the official ceremony of the cancellation of the stamp. Now I will explain. So I will explain the procedure now. So please stand here in the center because you will need to do things. So for the procedure, we need stamps. They already put on the envelopes. They already stamped on the and we also need a stamp, basically postal stamp or postal seal, which is valid for 1 day. On the seal there is an inscription, 1st of December, the World's AIDS Day. Now I'm putting this stamp on the correct place in the postal stamp, and I ask you to put your hand on this stamp and to push it by my command on me. 1, 2, 3, and push it very strongly and hold. And we need to repeat this procedure. Look how beautiful we got it. We need to repeat it 3 more times. 1, 2, 3, go. And hold and smile. Just for good pictures. 1, 2, 3, go. One, two, three, go. Super. Now I ask you, each of you, to take pen and on each of the envelopes to put your signature. Yeah, you can do it simultaneously at the same time. Traditionally, 2 out of 4 envelopes we present to our partners so that they could keep in their museums, and 2 go to the Museum of Ukrposhta. Once again, I remind that, okay, so you signed. Please take this folder all together and let's make a group picture. So the 1st of December, the Worldwide Anti-AIDS Day. Now we immediately transfer 2 envelopes to Ms. Yaroslava. And for our participants, of course, we have gifts from Ukrposhta, which contain the full kit, the full postal kit. That's for you, and that's for you. And again, one more picture, group picture. As of today, you can buy these postal stamps from online Ukrposhta store. Thank you very much. Miss Nataliia, I'm really grateful to you for this inspiring speech. I'm sure that we got inspired by this process. And I want to thank to everyone, first of all, to everyone who works today to reduce HIV/AIDS, and in order for people to get tested and to prevent and to keep their health safe. And I would like also to thank to our forces of defense forces, thanks to whom we are here today, have the capacity to carry out such events. And glory to Ukraine, glory to heroes. And I have a small announcement. We have the philatelist group who collect all the editions of Ukrposhta, who want to receive signatures from you. Please get to work.